Hello, everybody. Our research presentation is over the long-term effects of concussions on center of pressure displacement during balance and dual task performance among college-aged individuals. Just a couple of key points for you guys to focus on during our presentation. The first is the center of pressure displacement displayed among those college-age individuals comparing balance and dual task performance. And the second is the difference between those with a history of concussion and those without a history of concussion and their performance on dual task performance. To start off, we know two of the key symptoms experienced by those with concussions are impairments in balance and impairments in focusing during a cognitive task. This can impact athletes on the field and students within the classroom. And when digging into the research, we found that the short-term effects have been heavily studied, and these are less than 28 days post-diagnosis of the concussion. However, there is a lack of research studying the long-term effects of concussions and how these symptoms carry over into the long term. So we were curious to find out if these symptoms will carry over from the short term into the long term. And so we are going to study the long-term effects of concussions. And the purpose of our research study was to find if there is a significant difference between participants with a history of concussion and those without a history of concussion and their performance on a dual task. And for your reference, a dual task is a cognitive task being performed in conjunction with a balance task. And the hypothesis that we came up with was that there would be a significant difference between the two groups, those with a history of concussion and those without a history of concussion.
For our participants, we were limited to Clark students due to Clark's University's COVID-19 policies. So our inclusion criteria was then college-age individuals between the ages of 18 and 25 years old, and they had to be able to give written consent. Our exclusion criteria was any musculoskeletal, neurological, or vestibular deficit that would impair their balance, excluding concussions because that's what our study is looking at. We started recruiting participants by emailing Clark athletic coaches and speaking to the first-year DPT class. We were able to recruit 22 participants, 21 of which were either currently involved in athletics or had previously been involved in athletics. If you look at the table to the right of the screen, this is an overall summary of our participant demographics for our study. The average age was 22.5 years old. We had 3 male participants and 19 females. 9 had a history of concussions and 13 had no history of a concussion. Moving on to our methods section. Our study was a descriptive correlational study with independent variables being a history of a concussion, balanced task performance, and dual task performance. Our dependent variable was the center of pressure displacement. If you look at the flow chart on the right of the screen, this is the overall flow of our methods section. We started by recruiting participants with our inclusion and exclusion criteria, which I covered on the previous slide, and then it moves into the actual procedure of our methods section, which is our balanced tasks and then our dual cognitive task, which I will discuss further on the next slide. We started by having our participants perform 3 balanced tasks, which are shown here in the photos. We started by having them do narrow base of support, tandem stance, and then single limb stance. We allowed our participants to choose which leg they wanted to stand on during single limb stance and which foot they wanted to place forward during tandem stance, as long as they were consistent throughout the entire study. We picked these 3 specific balance tasks according to the literature. They are most commonly used when assessing the center of pressure displacement, so that is why we chose these 3 balance tasks. We had our participants perform 2 consecutive 30-second trials of each balance task. We then added our dual cognitive task to these 3 balance tasks. Our 3 cognitive tasks were counting backwards from 100 by 7s, stating the months backwards starting with a random month, and stating words that began with the letter K. We chose these 3 specific cognitive tasks, again, according to the literature. They are most commonly used when assessing a cognitive task during a balance task, so that's why we picked these 3. We had our participants perform 2 consecutive 30-second trials of the balanced task combined with a randomly paired cognitive task. After we collected all of our data, we then moved into the analysis portion of our study. We started by assessing for normality to determine which statistical test we could run. We ran a Shapiro-Wilks test, which found our data set to be normal. Since our data was normal, we then were able to run independent t-tests. We ran multiple independent t-tests to determine the significance between the center of pressure displacement with a history of concussions, dual task performance, and the sex of the participants. We used SPSS software to run our data analysis.
All right, so as far as the results go regarding our study, there were several factors that we identified as having a significant impact on our participants' center of pressure displacement during the balance tasks. Specifically, the implementation of a cognitive balance dual task had a significant impact on our participants' ability to balance while in a narrow base of support and tandem stance positions. However, we also identified several factors that did not have a significant impact on the results of our study. Namely, we found that the implementation of a cognitive balance dual task while in a single leg stance had no significant impact on the participants' ability to maintain their center of pressure. We also found that our participants' history of concussions, so whether they had a concussion or not, did not have a significant impact on their ability to maintain their balance. We also found that the participants' sex did not have an impact on their ability to maintain their center of pressure. It should be noted, though, just like Ashley was saying earlier, our study was heavily skewed in favor of female participants. We had 19 female participants and only 3 male participants. So even if the data did show a significant difference between these two groups, there wouldn't be a lot of weight to back up that data. So here we have a chart looking at the average center of pressure displacement amongst our participants, divided up based on their history of concussions. So over on the left, you can see our baseline balance task measurements, so narrow base of support, tandem stance, and single leg stance without the addition of a cognitive task. And then over on the right, we have the same 3 with that plus C along the bottom axis, indicating the addition of a cognitive task. Looking at these bar graphs, you can see that the addition of a cognitive task caused there to be slightly more differences between the two groups. However, none of these differences were found to be significant. Here we have another table showing an independent t-test that we ran between all of the balance tasks and conditions split between trials 1 and 2. We used a p-value of 0.05, and just as a reminder, that means that any value that we have on this table that is less than 0.05 indicates a significant result. And then based on this table, just looking at it, you can see that none of our data was significant. In fact, most of it doesn't even come close. The closest that we came was for tandem stance with the implementation of a cognitive balance dual task in trial 1 with a 0.074 towards the bottom left there. But even then, even though that's as close as we came, we still did not cross that 0.05 threshold. So none of our data was significant in terms of our participants' history of concussions. We also looked at the Chromebook alpha score, and what a Chromebook alpha score looks at is inter-trial reliability of our participants. So essentially it's how reliable and consistent our participants were in completing the balance tasks. At the bottom down there, we have a little breakdown of different categories. So for our narrow base of support, tandem stance, and narrow base of support with the cognitive balance dual task groups, we found that they were moderately reliable. And then for single leg stance, tandem stance with a dual task, and single leg stance with dual task, they were highly reliable, with the single leg stance and dual task actually just barely breaking that cusp of being considered very high in terms of reliability. And what this shows is that ultimately the participants in our study experienced a learning effect, meaning that as they performed the balance tasks more, they got more reliable, even with the addition of a cognitive task, which is not what we would have expected based on our hypothesis.
As Scott previously explained, the Chromebook analysis found that there was a learning effect with the tasks through the high interreliability scoring. This may have been due to exposed repetition of the balance tasks as they were completed twice on their own and twice paired with a cognitive task. So based off of increased exposure and practice, the participants could have improved over time, and this was found through our data analysis. Due to Clark University's COVID-19 protocol, we were limited to utilizing only Clark students as our subject base. This limited us as we were unable to generalize any of our findings to the public, and it also limited the number we could have recruited for our subject base. When administering the dual task interventions, there was no established pairings of the tasks. The tasks were randomly paired. For example, one participant would complete narrow-based support and would do the cognitive task of subtracting by 7, and the next participant would do narrow-based support and complete the cognitive task of reciting months backwards. Our main focus of the research was not to necessarily analyze the effect of the differing cognitive tasks, but more so to assess the effect the dual task pair had on the participants' displacement of COP. As the participants completed the study, we did not establish a standardized hand or arm placement when completing the balance tasks. This could have skewed our data depending on how each participant maintained their balance and where their arms and hands were in relation to their body and COP. Lastly, our force plate only recorded data within a small surface area, and this could have limited the COP displacement we collected. When completing tandem stance, some participants had larger feet that went outside the borders of the force plate, and this could also have skewed our data collection. As we've previously stated, the lasting effects of concussions were not significant enough to display differences in COP displacement compared to the non-concussed participants within our research. Through previous literature, through previous studies, we have found that there were many similar results with long-term impacts of concussions. One study found that participants who acquired an acute concussion and presented with gait parameter deficits, such as stride length and cadence, both being decreased, they all had deficits that had subsided within 2 weeks. Another study found that post-acute concussion participants who presented with postural stability impairments did not present with these impairments past the 4-week mark. Finding that the previous literature coincides with our findings in this research shows somewhat significance into the fact that the rehab concussion protocols are doing its job. Further research can be looking into the implementation of dual task interventions into different age groups, specifically the pediatric and geriatric population. These populations would be differing groups to investigate since there are high instances of concussions from athletic injuries, falls, and elderly and child abuse. Next, we would like to further investigate the acute concussion population and the implementation of this intervention to have better insight into the immediate deficits present immediately post-concussion, and also to allow this to be a tool to utilize throughout the entirety of the rehab and see how long the lasting effects exist for the concussion. We would also like to utilize an intervention of the dual task in high school and collegiate athletics for a baseline measurement. They already administer baseline measurements within high school and collegiate athletics, but it would be interesting to investigate the completion of dual task cognitive balance tasks at baseline and post-concussion to then utilize that as a baseline assessment as well as a tool throughout the entirety of their concussion rehab protocol. In conclusion, overall, we did not discover a significant difference in COP displacement between individuals with a history of concussion and those that did not. Through further data analysis, we did find that narrow basis support and tandem stance, when paired with a cognitive task, were defined as the most difficult. The most difficult is defined as the highest average of COP displacement across the board. So this task was found to be the most difficult when completing the balance task as well as the addition of the cognitive task. It is to be noted, while we found no significance, that there is significance with our lack of results. Our research and previous research coincide with the results that we found, showing that the concussion rehab protocol is doing its job and that patients post-concussion are rehabbing and resolving their symptoms in less than 28 days. With dual task interventions, they are greatly utilized within the realm of physical therapy. Dual task is a highly transferable to all kinds of activities of daily living and can increase safety and function for patient populations of all kinds. When used with the post-concussion population, it is important to incorporate cognitive as well as motor tasks, as these two systems are primarily affected with concussions. When utilizing these dual task interventions, the PT should be noting any physical and cognitive errors, as these would come about throughout the entirety of their concussion rehab protocol. We saw when adding a cognitive task to the balance tasks, difficulty increased through an expression of increased COP displacement. This shows that this combination is a great tool for challenging your patients as they progress their concussion rehab protocol. We would like to thank Brad Cruz, Lori Hyatt, Amanda Coakley, Melinda Oxenford, all of our participants, and Clark University for providing us with the feedback, encouragement, and resources required to complete this research study. Here are our references, and please let us know if you have any questions. Thank you.